2018, it will be on June 3rd. Visit the Take Steps table and talk to Aaron, our walk manager, and you could also go online at ccf.org, or Crohn's and Colitis Foundation.org. Camp Oasis, so I have a soft spot for that. We've had a camp for 20 years, and I was one of the first 5 people that we started camp. So it's something I'm very proud of. This is the only camp for just kids who have Crohn's disease and ulcerative colitis, and I cannot tell you that this changes their lives. It's just a regular camp, and it just so happens that all the kids have IBD. I've spoken to kids over the years who have gone to camp numerous years, and they did say how it has impacted them. At Camp Oasis, kids with inflammatory bowel disease can be kids, trying new things, making lifelong friends, hearing stories that sound familiar, and having the time of their lives. It's hosted at Camp Ronald McDonald for good times, where there's a pool, archery, horseback riding, a ropes course, and much more. Volunteer GI doctors and nurses are on site 24/7 to keep the kids healthy, and many of the volunteer counselors and adults with IBD have IBD who understand what our kids are going through and serve as role models. So join us in 2018. Mark your calendars for June 24th to June 29th, and we are currently recruiting both campers and counselors. The other program that's not in here, but I'll say like in 2 sentences, is Team Challenge. I participate in that. I do a triathlon once a year. At my age, if I could do an intermediate, you could do the sprint, and it's a great fun way to raise money and keep yourself in shape. I'd now like to introduce our speaker, Dr. Ashley Simon. She practices lifestyle redesign at the USC OT, Occupational Therapy Faculty Practice, and works predominantly with clients in the pain management, chronic headaches, multiple sclerosis, and ergonomics program. She received her doctorate of occupational therapy degree in 2011 from USC. She completed her residency at the USC Occupational Therapy Faculty Practice, where she saw clients and conducted market analysis. She received her BA in psychology and her master's in occupational therapy from USC. Welcome, Dr. Simon.
Okay, good morning. How are you guys doing? Awesome. It's still the morning, which is fantastic. I feel like sometimes when I talk in the afternoon, people get a little sleepy, so hopefully you've had your coffee. Okay. Let's see. This is my laser pointer. How do I advance my slides? This thing? Oh, thank you. Okay, so, like my introduction, I'm from the USC Occupational Therapy Faculty Practice, and whenever I give these talks, I always get asked, what is occupational therapy? And that's totally fine. My feelings are not hurt at all. Does anyone know what OT is? Has anyone had interactions with OTs before? Okay, a few people, fantastic. Oftentimes what I get is like, oh, you do hand therapy, right? Or, oh, you work with kids doing sensory integration, something like that, both of which have very little to do with IBD, right? So, occupational therapists look at how people occupy their time. We provide therapy through meaningful activities, or what we like to call occupations. So when you think about healing through activity, that's kind of what an occupational therapist does. If it's a kid who has a developmental disability, we want to be able to teach them how to play and how to, handwrite in school and those types of meaningful activities that they need to know how to do. If you're somebody who just had a stroke and you're in the hospital and you don't have the use of one side of your body, we might reteach you how to do basic occupations like putting on your pants again, or brushing your teeth, or taking a shower. So when you hear the term occupational therapy, all you need to hear is activity-based therapy. The goal is the activity. We want to be able to teach you how to do things like daily living activities. That's all. All right. So I consider myself to have 2 jobs at USC on our chronic pain team. The first job is to help people identify any areas of function that they are having difficulty with, which is usually not that hard to do. A lot of people know the areas of life that they kind of struggle with sometimes. And then to help them either compensate for those areas of difficulty, maybe rehabilitate an injury, and then teach people new skills, because oftentimes with a chronic condition comes the need or the necessity to learn new skills to know how to compensate for that. My second job that I consider, which is kind of related, is to help people change their daily habits and routines or their lifestyle in order to promote better health, which sounds so simple in concept, but if anyone has ever tried to exercise more, they know how difficult it is, right, to change your lifestyle or your behavior. I think a lot of people, when you want to change your diet or when you want to change your exercise patterns or your sleep or anything like that, think about how hard it is to change your behavior. You've been doing something for a long time, and to unlearn and relearn a behavior or a habit is very, very difficult. So we look at a lot of daily habits and routines, a lot of basic lifestyle behaviors, all for the intent of improving somebody's own pain management skills. As much as I love my patients, I do not want to see them forever, and they do not want to see me forever. So the goal is always to improve your own self-management of your condition, right? And of your pain. All right, and this is, I don't know if you guys have seen the Unstoppable T-Rex, but he's compensating for his functional difficulties with reachers, right? Because his arms can't reach anything. That's an OT trick. Okay, so under the umbrella of occupational therapy, there's a specific technique in occupational therapy called lifestyle redesign, and that is what we practice in my clinic at USC. And it's very simple. It's the process of acquiring health-promoting habits and routines in daily life. That's all it is. There have been a few studies that have come out. The most recent one I'll show you at the very end of our presentation, but it's a study that was published specifically about pain management and lifestyle redesign. And it's been shown to help people improve their health function, their quality of life, and their life satisfaction. And of course, because everyone wants to know, it's fairly cost effective. So when we think about what OT has to do with pain, like why I'm even here today, I think it's sometimes hard for other people to see, but hopefully easy for you to see, how if your lifestyle factors or your daily habits and routines and the daily activities and your functional level that you need and want to do, if those are working together, you can help to improve the management of your pain, right? And a lot of what you're going to see today, I think, as I looked through the panel of other speakers, is that a lot of this is about self-management. Some of it's about medication for sure. A lot of it has to do with disease course or whatever it might be. But you have a significant amount of control, which is a fantastic thing, because pain is something that interferes with pretty much every area of your life, right? So it's nice to know that the things that you do on a daily basis can impact your own functional levels, your own pain levels, and your quality of life. So that's why OT has a role. So you could probably tell me this. You probably don't need me to tell you this, but pain influences every aspect of life, right? Your physical functioning, your emotions and your mood, the behaviors that you do. So some people avoid behaviors because of pain. It can influence your spiritual practice, your social relationships, your cognitive functioning. But again, the positive side of this is that they can all influence pain also. If your social relationships, if you spend some time trying to foster those, if you improve your physical functioning or your physical fitness, if you try to do things that help to improve your mood, they can all have an impact on pain. So it's a bidirectional relationship. You absolutely, pain can absolutely affect all of these different things, but they can also affect pain, which is good news for us, right? We often think of ourselves as passive recipients of pain, and yet there's this part of us that kind of is able to override that thought and then be able to influence the state of our own health through our behaviors and through our actions. So there are certain things that can affect the experience of pain. So like the speaker before me just said, your mood and stress levels absolutely have a lot to do with pain. Any history of traumatic events, engagement or lack thereof in activity also has an influence on pain. I don't know if anyone's ever experienced this, but has anyone heard the term fear avoidance behavior, where it's like you're scared of an activity causing you pain and therefore you avoid it, right? Something like exercise is a great example. Movement might cause more pain, and if you think about exercise, you're like, that is the last thing I would like to do today, is move my body on purpose, because it's more painful. Deconditioning is often a secondary side effect of lack of activity, so we not only see the actual pain because of the primary condition, but also pain because of deconditioning, just because your body hasn't moved in a long time. The marital relationships one is actually interesting. There have been studies that have shown that if a spouse is over-attentive or overly involved, sometimes the patient themselves or the person themselves becomes more of a passive recipient of care, and that actually increases their pain. And then communication styles, being able to ask for help or not, being able to advocate for yourself or not, and then sometimes having some difficulty with pain communication. So these are some things that can affect the experience of pain or your actual pain levels, along with your expectations, right? So for a lot of our patients, it's difficult to hear that sometimes 0 out of 10 pain is not the goal. Sometimes less pain with more function is the goal. So your expectations have a lot to do with your pain levels themselves. Pain catastrophizing is when somebody says, oh my gosh, my foot hurts and it's going to turn purple, and oh my gosh, my foot's going to have to be amputated, right? Your brain jumps from reality to 5 steps beyond reality to what you don't know is going to happen. So it's like worst case scenario. If somebody is an active versus passive coper, meaning they try to actively engage in a coping strategy versus passively kind of accepting what's going on, that has a difference in terms of the experience of pain, and then their own self-efficacy or their own confidence level also has a lot to do with the pain experience. So then we kind of get down into the like physiology or the anatomy of pain too. So who here has heard of fight or flight? Pretty much everybody, right? Or almost everybody. Fight or flight is that sympathetic nervous system. It's that stress response that comes up in your body that causes a lot of inflammation and I would say, decreased attention to metabolic processes. So when your fight or flight or when your stress system gets activated, it's not just the inflammation and everything like that that's becoming a problem. When you experience pain and stress are part of the same nervous system, and we'll talk about that a little bit later, but they're both part of that sympathetic pathway up to the brain, so they share a similar pathway. So when you have pain, and when you've had pain for a while, your fight or flight system or your stress system is actually hypersensitized, right? Meaning that if I jump out and frighten somebody, I would never do this, but if I jump out and scare somebody who has had chronic pain, their fight or flight response is way higher than if I jump out and scare somebody who doesn't have chronic pain. So their response to the stressor is higher, and their nervous system has been sensitized because of that. It also takes a lot less to scare somebody, or I should keep saying scare. It also takes a lot less to trigger that stress response or that fight or flight nervous system activation for somebody with chronic pain. So that nervous system really is an important piece of this, and what you'll find is that a lot of what we do in terms of lifestyle redesign and lifestyle changes has to do with nervous system stabilization. Just trying to get your nervous system to be at a more typical threshold rather than being super sensitized all the time. We also see that that for people with chronic pain, their muscle tension tends to be higher just because increased muscle tension is a symptom of pain. And so when you're tense all the time, think about what happens in your body. You start to get pain in other places. You start to make the current pain that you have worse, right? So muscle tension has a lot to do with chronic pain too. And then not just in your body and your nervous system, but also going up to your brain. We actually see brain changes in people who have chronic pain because of that nervous system sensitivity. The good news here is that a lot of the times we can actually, through cognitive behavioral therapy or graded exposure therapy or whatever it might be, lifestyle changes, we can actually change that brain sensitivity. But if I were to stick somebody through a scanner and I were to show them a brain with chronic pain and a brain without chronic pain, you could actually see different centers of the brain light up brighter in somebody with chronic pain. So again, that nervous system sensitivity and that brain sensitivity has a lot to do with this. Okay, so sometimes when we think about chronic pain management, there's a lot of different barriers that people encounter, right? And I think working with these barriers and sometimes working through them is a lot of what we do in occupational therapy. We help people problem solve through these barriers. So a lack of social support. If you don't have good social support, it's very hard to have a good pain self-management plan. Limited financial and transportation resources, to name a few. We often deal a lot with limited financial resources and trying to help people navigate around those issues. We have a social worker on staff who can help with that too, especially in our neurology clinic. Mood and stress levels. We already know that those can be difficult to deal with on their own, and when you combine them with pain, they're even more difficult to manage. Sometimes ineffectiveness of certain self-management strategies that are already existing, time constraints, that fear avoidance that we talked about before, and then lack of tailoring strategies to meet your personal needs. I think something that a lot of people with chronic conditions are good at is taking a recommendation and catering it to themselves. And that's a strength that you guys should all pull upon. Let's see. And then, physical limitations for sure. And that's where something like OT or physical therapy can really step in and help you, because we can either try to rehab the physical limitation or we can help you compensate for it. So let's dive into these lifestyle changes, because I think this is where kind of the meat is. So in lifestyle redesign, these are just examples of a few different, we call them modules, but they're like topics that we talk about with our patients on a week-to-week basis. So pain education is a big one. We spend a lot of time educating people about the mind, body, the nervous system, sensitivity, all of that kind of stuff. We help people identify triggers oftentimes. I think, has everyone here experimented with their diet? Pretty much, right? And it's so hard to find out, and to figure out and distinguish, what's a real trigger for me and what's not. Because sometimes something is a 10% trigger, but it's not like 100% trigger. So you can eat it one day and not have any symptoms, and eat it another day, and it just wrecks your body, right? So trigger identification is a big deal, and we often use a lot of logs, a lot of problem solving to help people figure out, okay, is this not a trigger, a moderate trigger, or a for sure red flag trigger? Try to avoid this at all costs kind of food or activity or whatever. We'll talk about exercise routines and eating routines and sleep. We do a lot of stress and mood work with our patients because of the close tie between stress and pain. And then we help people kind of with a lot of these other things like ergonomics and body mechanics, which we'll talk about, community reintegration, lifestyle balance. Again, if you're thinking about how all of these things affect IBD in particular, this is all about trying to stabilize your nervous system and trying to give your body the most optimal environment for healing, right? So let's dive into I'm not going to go into all of these, but I will dive into probably half of them today. They're kind of the bigger ticket items that I feel like you should know the most about. So let's start with sleep. So with sleep, is everyone fully rested and totally alert and awake? And yeah, right? Sleep's a big issue. It is, I call it the great regulator. Like, if I could be a magical fairy and sprinkle everyone with dust, it would be sleep dust, because sleep is the absolute greatest regulator of your body, for sure. And when you have pain, sleep is affected. So falling asleep, finding the right position, being able to stay asleep and not wake up because of pain, being able to fall back asleep once you wake up because of pain or because you need to use the bathroom or whatever it might be. So sleep is a big deal. And what we see is that the nervous system is absolutely dysregulated when you don't get good quality sleep. Sometimes it's a duration issue, sometimes it's a quality problem. It could be both. But what we see is sleep onset problems and poor sleep efficiency can cause a lot of, insomnia, frequent waking up too early, not being able to fall back asleep, that kind of stuff. And that further, in addition to your already existing pain, increases your pain sensitivity. So when not we, because I don't do this to people, but when researchers sleep deprive people in studies, their pain sensitivity actually goes up. The same stimulus that I give to somebody who's not sleep deprived is not the same as a pain stimulus that I give to somebody who is sleep deprived, right? So sleep has a lot to do with the chronicity of pain and your sensitivity and your nervous system, right? So now that I've said that, and now that we're all like, God, I didn't get a good night's sleep last night, what do you do about it, right? So, sorry, getting over a cold. So there's a few things that you can do, and again, this doesn't mean you should do this every day, all day, because I don't do this every day, all day. You have to pick the things that you think are gonna make the biggest difference for you. Or you have to experiment a little bit and figure out what works best for you. So, sun exposure is actually a big deal. If you are inside a lot of the day, like this, and you have no sun, your body, to a certain extent, the bright lights are okay, but your body needs to be exposed. Indirectly is fine. It doesn't have to, you don't have to like stand out in the sun for half an hour every day directly and start sweating. But if you don't expose your body to light in particular, but especially sunlight, your body becomes dysregulated, because sun exposure is how your circadian rhythm gets set for the most part, right? So when you wake up in the morning, open your blinds. And when it's time to kind of wind down at night, that's why everybody says, get dimmers on your lights or start turning lights off, or, don't look at your phone, because all of that is stimulation and it's telling your brain, hey, don't release melatonin because it's still daytime, right? It could be like 11:30 at night, but if all of your lights are on like this and you're staring at a TV, your body still doesn't know that it's nighttime. So it's not going to release melatonin that helps you fall asleep. So sun exposure is a big deal. Making sure that you have enough mental and physical exertion during the day can help your sleep drive at night. So on a day like today, if you commuted here and then you sat in this all day, so you had a lot of mental exertion, right? You could still go home and your body might still kind of be a little bit restless. So you have to have both physical and mental exertion to make sure your sleep drive is high at the end of the day. Who here goes to bed at really consistent times? You're like a clock, yeah. Yeah, most people don't. My dog does. She's great. 9 o'clock on the dot, she's just up in our bedroom. She doesn't care. So consistent sleep and wake times are important only because then your body has a predictable schedule. And that predictable schedule is something you'll hear as a theme throughout all of these different things. When you have a very predictable schedule, you don't have to be a boring person. Your body just has to be on a boring clock. But if you have a predictable schedule, especially in regards to sleep, your body is much better capable of syncing to that rhythm. It knows what you want it to do, it knows what time you want it to do it, and it does it better. Avoiding stimulating activities and substances before bed. Unfortunately, in the short term, alcohol is actually a short-term depressant, right? So in the short run, it's often, I think a lot of people are like, oh, glass of wine, nightcap. You know what I mean? It helps you relax and all of that fun stuff. Long term, it actually interferes with a lot of your sleep wave regularity. So ideally, we'd avoid any kind of stimulating substance before bed, except for sex. That's fine. And you would actually start winding down, ideally an hour, but if you can't do an hour, 30 minutes before bed. And that is because you can't go from 100 miles an hour to sleeping right? Your body's got to wind down somehow. So to facilitate that process, you have to start winding down and decreasing your stimulating activities and then doing more relaxation, which we'll talk about in a sec. Duration-wise, I always get this question. It is really individualized. Most adults need anywhere between 6 to 9, but usually it's about 7 to 9 hours, which sounds like a lot. And then in terms of positioning, we work a lot with our patients to find, it's not going to be maybe ideal, but optimal positioning for comfort. A lot of pillows are involved, a lot of shifting, and that's totally fine. Not because I'm pregnant, but because positioning is important to me. I use a pregnancy pillow to sleep because it keeps me in the position that I want. So you can find whatever works for you, but finding like 1 or 2 ideal positions is really, really beneficial. All right. Eating routines. So again, lots of people have experimented with diet, right? Pain, again, there's this bidirectional relationship where you have food triggers that can influence pain, but then your eating routines can also influence pain in themselves, just without even thinking about dietary triggers. And pain can also influence your eating routines, right? So we want to make sure that you have enough nutritional value. We want to make sure that, if the pain is causing decreased appetite or skipping meals, your nutritional content is sufficient. It can cause emotional eating, like overeating also, so on the other end of the spectrum. And that all of this stuff can influence your energy levels. And it can also influence further dysregulation of your nervous system, right? If you're constantly in this like low blood sugar state and then you spike your blood sugar once in a while, that's not going to be good nervous system regulation. If you're in a nice little zone of blood sugar, that's going to be optimal blood sugar regulation and nervous system regulation. So, what do you do about it? So ideally, you'd be eating about every 2 or 3 hours to keep your blood sugar consistent, right? You'd be choosing foods that help you to regulate your blood sugar and your energy. And I know everyone always says, well, the foods that are like really high and are really good for blood sugar regulation are super healthy, give me pain, right? Like they actually trigger things for me. So you have to I call them safe foods. You have to find like the overlap. Even if it's like 4 foods, you have to find that overlap between foods that are going to be relatively healthy and good for blood sugar, but that also may not, or may be minimal triggers for IBD symptoms. We ask a lot of people to develop simple meal prep strategies so that you don't have to spend so much energy prepping your meals all the time. And then trying to increase your water intake is a big deal. Some people find it easier to digest, lukewarm water or room temperature water rather than cold. It just depends on the person, but your fluid intake has a lot to do with your energy levels, with your digestion, all of that kind of stuff. And there is that diet and nutrition talk today at 1:35 if you are interested. So I would highly suggest going to that. Okay. So exercise. Again, regularity is kind of the key here. You can actually give your body little doses of pain management, like neurotransmitters, through exercise. So endorphins are painkillers, basically. So when you exercise, even though it might be uncomfortable or be more painful at the beginning, long term, you're giving your body a dose of pain medication, which is nice. So the other thing that exercise is particularly important for is bowel motility. If you don't move, your bowels don't have that kind of motility and the movement that they need to do their job. So exercise becomes a very, very important part of IBD management and pain management in general. It's also really good for stress and mood. It improves your sleep. It can lead to healthier eating patterns. It can improve your memory and concentration. Like, who wouldn't want to take the pill that does all of this, right? I would totally take this pill. Unfortunately, it's not a pill, it's exercise. So you have to do it. So when you think about exercise, part of the problem, you need a little cheerleader, right? Part of the problem is people often pick the wrong exercise for them. And I'm not saying it's like, walking is not for everybody. I'm not saying anything like that. What I mean is that when you are first trying to start or improve your exercise routine, you have to take it slowly and you have to choose something that's like fairly motivating for you. Otherwise, you're never going to do it, right? I have like tons of exercise DVDs at home that I never use because P90X is just not that realistic, right? So you have to find the just right balance. It's got to be something that, you start small. And ideally, this is good for behavior change too. So when you start small, especially in terms of exercise, it's going to feel like you did nothing. And that's a good thing because it should feel easy, right? So if it's just like going for a walk for 15 minutes and that's where you start, fantastic. You just went for a walk for 15 minutes or 5 minutes, whatever it might be. If it's doing light stretches on the couch or in bed, and that's what you feel like you can manage right now, that's totally fine. But you start with a level that you are comfortable with, and then you slowly build on that. Because what we don't want you to do is go full bore and be out of commission for like 2 or 3 days and be in extreme pain and then say, oh, I can't exercise because it gives me more pain, right? So, the way to tell usually is if your recovery period after you've exercised is anything more than 24 hours, usually you've gone a little bit too far and you need to scale back a tiny bit and then, grade when you feel like you're ready. So some tips for exercise: make sure that you're hydrated because your muscles will actually have more tension and pain if you're not well hydrated. Use good body mechanics when you move. Body mechanics, which we'll go over in a second, is an incredibly important part of pain and IBD management specifically. And you want to begin with a short duration and low intensity and increase gradually, like we said. So the other part of this is you want to make sure that when you exercise, you're actually having a little bit of a warm-up, some stretching, the exercise itself, and then a cool down period afterwards. Because if you just go straight into exercise, sometimes even that can cause more pain. And then the last piece of exercise is always that like accountability, right? So if you have someone that you're willing to be accountable to, and I feel like sometimes significant others are not the best people to do this, because when you are accountable to them, it can create problems. But you need to have some kind of accountability resource, right? It could be yourself, it could be, but I've met very few people who are really good at keeping themselves accountable. A lot of people use apps nowadays to keep themselves accountable where, little things will pop up that says like, hello, you have not logged exercise for 3 days. But it depends on the person. So you have to create a schedule that works for you, and you have to find an accountability resource that works for you as well. Okay, so energy. I feel like energy is one of those things that is very nebulous. I always think that there's different sources of energy when we're thinking about trying to manage energy better. I always feel like there is the physical side of energy, the emotional side of energy, and then the cognitive side of energy, right? So if you expend a lot of cognitive energy like you are today, you're exhausted. And you're like, all I did was sit in a chair for 6 hours. How is it possible that I'm exhausted right now, right? But you have to think about all of these different sources of energy. You could you could have a day where you're like walking a ton and you're shopping and you're physically tired, but you're like mentally still very awake. So think about the different sources of energy and how they interplay with your total energy stores. It's also really helpful to think of energy as a finite resource, like almost like spending money, or I'll show you the most common energy, motif in a second. But think of energy as a finite resource, and therefore spend it wisely and don't overspend, right? If you overspend, you pay for it the next day. So when we think about energy, you can actually slowly, as long as you slowly do exercise the right way, you can actually get more energy from exercise over time. For the first few weeks, it'll feel like depletion. And then you'll actually start to feel like your body is starting to norm to a new energy level because you're expending more energy because of exercise. Keeping a regular daily routine is a fantastic way of saving cognitive energy, especially. If you have a daily routine, your mind goes on autopilot. and then you don't have to think about what has to come next, right? Managing depression and stress, for sure, can help you save energy because mood and stress are both energy sucks, right? It takes a lot of energy to feel stressed out. And then save energy. This is an energy conservation technique. Save energy where you can. If you, if you think about your kitchen, are you walking around and bending and moving and reaching in all sorts of different places to get just one meal together, right? Are your plates up here, but then your cups are over there, but then your utensils are behind you, and then your pots are down low? Or do you keep like 3 sets of plates, utensils, and cups that you just use over and over again, all in the same one place, and then your extras are kind of dispersed? Are your pots and pans readily accessible, or are you having to bend a lot for them or something, right? So save energy where you can. A lot of people will, because of this, will buy like semi-prepped foods, like, the pre-washed organic spinach or something like that from Trader Joe's, I don't know. A lot of people will use something like Amazon Fresh or Vaughn's Delivery, because then they don't have to spend the energy to go food shopping, right? And then my favorite, get other people to do it for you. That's a great way of saving energy. So has anyone heard of this spoon theory? Really? Only a few people? Wow. Okay. Yay. So the spoon theory, if you just Google spoon theory, it will be the first link that comes up. It is probably one of the most popular energy management analogies that's out there in the chronic illness world. So a lady was sitting at dinner with her friend, and her friend was like wondering why she kept canceling dinner all the time, right? She was pretty, like having a hard time being consistent with committing to a time and actually showing up when they wanted to have dinner together. And so this lady with the chronic illness went and gathered all of the spoons in the diner and basically said, okay, I start the day with 15 spoons. If I want to get out of bed, that's 1 spoon. If I want to brush my teeth and brush my hair, that's another spoon. If I want to take a shower, that's 3 spoons, right? What are we up to now? 5. If I want to make myself breakfast, that's 2 spoons. If I want to check my email, that's 1 spoon, right? So she kept going through her day, and by 1 o'clock in the afternoon, she said, I've got 3 spoons left. So do I go to dinner with you, or do I do my self-care routine and have dinner at home? And that's why I never make dinner, right? So it's this concept of energy being a finite resource that you have to plan out and spend more wisely, just because if you try to borrow from tomorrow's spoons, it's going to significantly impact your ability to function for the next few days, right? So that's the spoon theory. It's basically saying, okay, spend your energy wisely, plan ahead, and prioritize. And that's exactly what we have to do. Then there's activity pacing, and this is the whole concept. I feel like I fight my patients with this all the time, because what do you want to do on a good day, right? If you're having a good pain day or a good energy day, what do you want to do? You want to do as much as you freaking can, right? Because you might not have a good day tomorrow. But what's the problem with doing as much as you possibly can in one day? You're exhausted. And then because of the overexhaustion, you're priming your body already for tomorrow to be a bad day. You're basically confirming what you think is going to happen, which is, oh my God, tomorrow's might be a bad day, so I'm going to do as much as I can today, right? It's like this self-fulfilling prophecy. The hardest thing that I ask my patients to do is to pace themselves and to still use the same energy management and pacing techniques on a good day that they do on a bad day. And they always tell me they feel like they're holding back, because they are, but that's how we get the train rolling in the right direction. That's how we get multiples of good days in a row, rather than one good day and paying for it the next few, right? So the idea of activity pacing, I love these dogs. The activity pacing idea is essentially alternating periods of activity with periods of rest. But you can do this on large or small scales. So on a large scale, it can look like, you plan your week out, right? Like, okay, Saturday is the USC football game. So then Friday, I'm going to rest, and Sunday, I'm not going to schedule anything. So that's kind of large scale pacing. Same thing with, like a day like today, where it's like, conference sessions, right? Maybe you don't go to certain conference sessions and then you take a break and go lie down in your car, or maybe on your break you walk around a little bit. But it's this idea of interlacing activity with breaks so that you never overdo it. Then there's this idea of small scale activity pacing. So this was large scale. The idea of small scale activity pacing is probably a bit harder because it takes a lot more mindfulness on your part, right? The first one was kind of planning or whatever it might be. This one is about mindfulness and checking in with your body and understanding what your body is telling you. And this is, I think, the harder one to do. So this is an example of someone doing laundry and using small scale pacing. So they start by sorting their laundry, and then they check in, and they're like, okay, pain hasn't increased, I can move on. They carry the bags downstairs one at a time, they check in, their pain has slightly increased, so they do a 2-minute break, pain returns back to baseline, so they're like, okay, my pain returned to baseline after just a couple of minutes, I can keep doing the activity. Put the laundry in the washer, read the newspaper seated to rest, put the laundry in the dryer, check in again. Pain has increased moderately. Okay, so now, because the pain has increased moderately, they go lie down, they do some deep breathing. This helps with the pain level, so then they can continue the activity. Get the clothes from the dryer, get help carrying the bag upstairs because they know it's going to be too much. Hang the clothes that need to be hung, check in, pain has increased moderately again, take a rest break, and then fold the clothes while seated. So you see how you're interlacing these small little periods of rest. It doesn't have to be long, it could be just a couple of minutes. But the goal is to never let your pain or your energy get so out of whack that you can't return back to baseline, or that you're having a hard time returning back to baseline. So that's small scale activity pacing. And that is really hard to do because it involves time and effort, right? During your daily activities, like something like doing laundry, it involves a lot of involvement cognitively. So a lot of people have issues with this, but this is probably the most helpful thing that people can do in terms of activity pacing, is this small scale little mini breaks. Okay, body mechanics. How are you all sitting right now? Right? I feel like every time I talk about body mechanics and ergonomics, like everyone's height increases by like 2 inches in their chair. So the whole point of body mechanics is neutral positioning of your entire body to protect your joints, your muscles, your organs, all of that kind of stuff. In this specific case with IBD, a lot of it has to do with promoting optimal gut motility and functioning, and not cutting off your gut function. So this can, and it applies to how, sitting, standing, lying down, when you're moving, doing activity in the home office car. Basically, your body has to be in some position at all times, right? So it applies across the board. So what we want people to think about is what you feel like, or what optimal functioning feels like for you. For some people, especially when we think about the gut, when they tilt their pelvis forward, it actually helps them a little bit to feel like things aren't as tight or as squished. Some people have a natural tendency to tilt their pelvis backwards, and that actually feels better. So for you in particular, you've got to figure out what your neutral or optimal position is, right? To kind of open up the abdomen and to figure out what that best feels like for you. And then the goal is to maintain that position in whatever activity you're, bending, moving, that kind of stuff. So when you're sitting, for example, if you have this tendency to close off and crunch your abdominal cavity, then you're probably cutting off some circulation, motility, all of that kind of stuff, right? If you overcorrect and you're arching your back, you're stretching things, which is also not a good thing. So to find that neutral position that feels best for you, right in the middle, that's something that you kind of have to experiment with. So if you think about activities of daily living, these are some ways to improve your body mechanics. So when you're reaching, instead of doing a big old reach like this, you can use a step stool. Instead of bending over, instead of bending over like this, if you're sweeping or picking something up, see how there's that curvature in the back? Keep your back straight and using your legs to bend instead. That's going to be a good idea. When you're doing laundry, instead of bending over like this, which I feel like is what everybody looks like at the laundromat, you can kneel next to the the front load washer or dryer, and try to get in there like that, see how her spine and her abdomen are better aligned. Or you can use a reacher if you want to. And then same thing with washing your face or washing dishes. Instead of doing this, I call it the butt out bend. Instead of doing that butt out bend, you can actually prop your foot up on a stool or open the cabinet and prop your foot up inside, just to keep that spine and that abdomen a little bit more neutral, right? And if that's super boring, then just think about sex and body mechanics and how that could work. And it becomes more interesting. Okay, so I want to spend the last part of my time talking about stress and mood management, because like we heard in the speaker before, this is actually a huge, a very important part of you managing your own pain and your own IBD symptoms. And like we said, pain and stress have this very intricate relationship. So pain can actually trigger an emotional response, and emotional state, like people with acute stress, can trigger pain and symptoms. So we already know that there's a connection. We just want to know how to control or how to manage it, right? With stress, the primary effects are often increased symptoms and pain exacerbation, dysregulation of the nervous system, or more dysregulation of the nervous system, I should say. The secondary effects, when your people are stressed out, they have less time for healthy eating routines, they have less time for sleep, they have changes in their mood, all of that kind of stuff, right? So, I'm going to go through these general things, and then we're going to go through a few specific relaxation techniques that I don't think we have time to do, but you can definitely research them on your own because there are so many resources out there. So the first thing that we often do with our clients is we help them identify their triggers of stress, which sometimes is not that hard, because people often know why they get stressed. Trying to remediate those triggers, though, that's a whole different story, because not every stress trigger can be remediated by any means. The other thing that we help people do oftentimes is figuring out what your own signs and symptoms of stress are, so you can catch it earlier. So for example, for some people it's increased heart rate, for some people it's getting flush, for others it's a little bit of cognitive fog, right? For me, it's dropping things. I know that if I'm dropping things, I'm rushing, and that's when I'm super stressed. or moderately stressed, I should say. The whole point of knowing your signs and symptoms is being able to catch stress in the early phases, because just think about this is almost like a medication, right? The sooner you take like a headache medication, the easier it is to get rid of the headache. If you wait too long and that headache gets out of control and then you try to take medication, all of a sudden you can't control that headache as well. Same thing with stress. So being able to catch it early makes a big difference. You also want to make sure that you have an acute plan and a chronic plan, meaning you want a daily stress management routine. That's your plan to combat chronic stress. And then you also want a plan for acute instances, like someone rear ends you on the 101 freeway and you freak out, right? You want a plan for that as well. Thinking about what coping strategies you currently use, and they might not be healthy, but you have to be aware of what coping strategies you're currently using, like avoidance is a big one, right? People just tend to avoid stressors. And then knowing that you have to train yourself in relaxation techniques for that chronic stress management. So a lot of people will say, I tried deep breathing once and it didn't work for me. Well, if you tried tightrope walking once and it didn't work for you, would you say that you're just not a tightrope walker at that point, right? No, you have to train yourself to do it. So same thing, you have to train your body in a relaxation technique to elicit a certain response. So these are some common relaxation techniques. We'll dive briefly into each one of them. So diaphragmatic breathing, visualization, muscle relaxation, mindfulness. And then just so that you know, biofeedback is it's something that you do in conjunction with your training, and you have to do it with a healthcare provider. But it's essentially a resource that helps you to see how well you're doing with your training. So we often use muscle tension or EMG feedback as our biofeedback source, and we hook people up, it's just a reader, so it doesn't zap you or anything like that, but we put little readers on people's muscles, and we can see how tense they are, and when they relax, how much more relaxed they can get every session. So biofeedback is something that's a really useful tool if you're interested. So with diaphragmatic breathing, basically it's a very basic concept. Fast breathing is part of the stress response and slow breathing is part of the relaxation response. And we want to elicit the relaxation response. So these are kind of some steps that you can follow. But essentially, when I do deep breathing training for people, my primary goal is just to get them to breathe slower. That's it, right? Once they get really good at breathing slowly, then I might add in the diaphragmatic piece, which is breathing down into your belly and making sure that you're using the lower tier of your lungs. But when I introduce that too quickly, I often find that people just get frustrated and then they get more stressed because they're like, they're like trying to figure out what it means to do belly breathing. So the best way to start is to just by kind of breathing normally and then trying to lengthen every single breath. That's it. And if you want, you can start doing the diaphragmatic part, which is this optional piece down here. And then if you want, even after that, you can start counting. That helps some people, is to regulate each breath by just counting. So this, by the way, means 4 counts in, 4 counts holding, 8 counts out. And then there's another commonly used count, which is 4 counts in, 7 hold, and 8 out. But you can do whatever you want. So that's diaphragmatic breathing. There's also visualization and imagery, right? Does anyone use this, by the way? Yeah? It's especially for like visual people, it's a very effective strategy. You can either picture your favorite place, and you can, like my favorite place is the beach. So I picture what it feels like to be there, but then I also try to feel the sand between my toes, and I try to feel the wind on my skin. So you involve all of the senses. And what happens is the parts of your brain that would light up if you were really at the beach, they don't light up as much, but they start kind of lighting up because you're imagining yourself at the beach. So you're still getting some of that stress relief quality in terms of endorphins and all of that stuff. The other thing that people do, especially with pain, is pain visualization. So often people will picture, if the pain is in my hand, they'll picture the pain flowing out of your fingertips. Or they'll picture the pain gathering at the back of your throat, and then with the breath out, the pain gets expelled from the body. So there are specific pain visualization techniques that people can use as well. Progressive muscle relaxation is exactly what it sounds like. You progressively relax your muscles. Usually people start from head to toe. You can go toe to head. It's up to you. And you can do it with or without a physical squeeze. But the essence of it is essentially to start with little muscle groups and to go muscle group by muscle group. So, your forehead first, and then your eyes and your cheeks, and then your jaw, then your tongue, then your neck, then your shoulder. You work your way down, and with every single muscle group, you're progressively relaxing each and every muscle, because muscle tension is part of the stress response and muscle relaxation is part of the relaxation response. And then last but not least is mindfulness meditation, which is kind of I would say it's like a trendy topic or a hot topic in healthcare right now. And it's basically paying attention on purpose in the moment without judgment. And that last piece is the hardest piece, right? You're not supposed to judge your thoughts. You're just supposed to notice them. So if you are noticing that you are in pain, you register and you notice, and then you try to observe other things, right? It's not saying, oh my gosh, I'm in pain and now this and this is going to happen, or I'm noticing that I'm not doing my deep breathing like I should be doing, right? You don't get to judge. It's literally just noticing, and that's it. The goal is to create this attention to your own body and mind in an open and accepting way. It's not really to eliminate pain or, think of nothing, right? Like a lot of people say, I can't meditate, I can't clear my mind. I can't either. That's hard for me to do. It's paying attention to something else on purpose. And the theory is that mindfulness-based stress reduction can actually help people create this wise relationship with their body so that they can make better decisions in the moment. So there's a ton of resources on all of these different strategies, and you can find them online. But I would encourage you to explore them because these are the types of strategies that really help people self-regulate their nervous system on a day-to-day basis. And they're also really good in acute instances if you're already practiced at them. So this is the article that I mentioned before about our chronic pain and lifestyle redesign program. This is the study that we most recently published about pain and lifestyle redesign. We already said that. So I think, do I have like 1 or 0 minutes left? Tell me. Oh, 3. Look at that. Oh, it talks so fast. Okay. So I'm happy to take questions. Otherwise, they asked us to kind of hang around outside of the auditorium, so I'll do that after. Yeah. Yeah. So, and sometimes like avoidance or ignoring are impossible, right? A lot of it has to do with how you are processing, because we can't control other people. If it's somebody who's worth it in your life who doesn't understand and the comments that they're making are because of their lack of education about what's happening to you, and it's a person who's important to you, it might be worth it to educate them. If it's somebody who's a stranger and who's just making, or a coworker or something, and they're just making some comment and they have no idea how it affects you, we can't control their behavior, and it might not be worth it to try to educate them about what's happening. And therefore, a lot of it has to do with how you're processing things, right? Telling yourself like, okay, they don't know the whole story. If they did, they would not be saying these things, or I'm gonna, try not to be a mind reader and infer that this person is making assumptions about me. I'm just gonna take what they're saying for face value, whatever. But a lot of it has to do with cognitive processing on our part. Okay, so I'll hang out outside for a little bit, but thank you very much for your time. I hope you guys have a good day.
Okay, so I think I have a closing remark here. Thank you very much, Dr. Simon. As a reminder, the slides for all the talks will be emailed out after the conferences. Now we're going to break for lunch. Please go to the buffet table in the lobby, and we'll get started with the doctor panel, which I've sat through many times, and it's really interesting. So be sure to come back here at 11:45 for that.